I think my issue really is that the traditional pelvic floor training works just on the pelvic floor. And we know, teaching hypopressives, that there's this intrinsic connection with the diaphragm. So, and that we are, by just working on the pelvic floor, we're treating it as a muscle group. And when we do hypopressives, we're working on all of the tensions in the body. We're working on the whole myofascial web to unpick it and release areas of tension. So it's just a bit short-sighted. It's like someone has a knee problem and it hurts, just looking at the knee, not looking at anything else around it. And you know in your job that you're looking at the body as a whole picture, and that's what we do with hypopressives, is we're looking at that person as a whole and working on all of what will help those pelvic floor symptoms, and not just squeeze the hell out of your pelvic floor however many times a day, follow an app that that's going to prompt you and, you know, potentially make things worse. Because, you know, in my own personal journey, and we talked about this last time, I found traditional pelvic floor training was disastrous for me, and I started looking for something else because my symptoms were getting worse, not better. So, and that is the case with a lot of women.
Yeah, and I remember reflecting in that last show that we did that as a male practitioner, it's very hard to put yourself in the position of a woman who's suffering from what is a very embarrassing and inconvenient problem, isn't it? Remind us what the other problems which might be associated with, which you might be able to help with hypopressives are. You've mentioned hernias.
Many.
Pelvic organ prolapse.
Yeah.
A bigger problem than most realise. Again, go into the research, wide and varied statistics, but it's reckoned that probably around 50% of women will experience a pelvic organ prolapse at some time in their life, and that increases with age. The chances increase with age. They increase with childbirth and the number of children you have and the time between the children that you have. Hernias in terms of prevention. So once the tissue is outside of where it's supposed to be, you're not going to get it back. But in terms of managing symptoms and making sure things don't get worse and preventing it in the first place, I think it has a key role. For men, because I'm sure there are men listening to this now.
Well, we've all got male patients as well. So.
Yeah, exactly. And men do suffer from incontinence. They suffer from fecal incontinence as well. But I think hernias for men, but also the role in with hypopressives after men have had prostate surgery is really interesting, because there has been a small scale study done on that. The role of hypopressives alongside Pilates, so fitness Pilates. I've
never heard of that.
Yeah, no, I hadn't either. So it's literally a sort of like more rigorous form of Pilates, I think. They did a small scale study, and it improved the symptoms of men who'd had a full-scale prostatectomy, so full removal of the prostate gland, in terms of their urinary control. So they started to get back urinary control. So I mean, we've just, you know, we're talking about mostly here. We've been talking about women's problems, but sexual function in men and women, posture is another great one, and we haven't really touched on the role in the athlete. So breathing, to start getting someone to breathe through their nose for a start, because most people aren't, well, I say most people, a lot of people aren't breathing through their nose. Getting them to breathe laterally, all of these things can contribute to athletic performance. So they, in Spain in particular, hypopressives is used quite often by athletes for training the posterior chain, but also making sure that they are maximising their oxygen carbon dioxide ratios.
Right.
And endurance athletes basically is the area that works best with.